Hi everyone, today we're going to be talking about our novel idea for a biodegradable mesh for pelvic organ prolapse. My name is Leah Uglovich.
I'm Bailey Ullman.
I'm Bethany Brown.
I'm Chase Dubé.
Pelvic organ prolapse, or POP, affects 40% of women worldwide. POP occurs due to the stretching or weakening of the muscles and connective tissue that support the pelvic organs. It can cause the descent of the uterus, bladder, or rectum, as seen on the right side of your screen. POP may manifest into a variety of symptoms, including vaginal discomfort, back pain, pain during intercourse, urinary incontinence, and psychological distress, all of which lower the quality of life for those affected. This condition most often occurs as a result of vaginal childbirth or with aging as women experience menopause, and the highest incidence rate is in women ages 60 to 69 years old. In 2023 alone, the U.S. reported spending $4.5 billion on POP procedures. Conservative treatments are often the first course of action for those with POP. However, they are not curative and only delay the progression of prolapse. Pessaries are one method which attempt to restore the anatomical positioning of the pelvic muscles, but 15% of users are unable to use the device due to fitting failure. Surgical options, while invasive, result in more successful outcomes. Obliterative procedures repair prolapse, however, they do eliminate the possibility of future sexual activity. Reconstructive surgeries, on the other hand, utilize native tissue for repair and restore the proper anatomical functioning of the organs. This procedure has a 32% rate of prolapse recurrence and was previously aided through the use of surgical mesh, but this has since been discontinued in the US for safety and efficacy concerns. With such a high incidence rate among women, it is imperative to identify a more effective and long-lasting treatment alternative for POP.
On the screen, you can see a top view of the pelvic floor where our cut-to-size biodegradable mesh scaffold will be placed. Now you can see our scaffold placed on the pelvic floor. This will be a biodegradable PLGA scaffold of a 75 to 25 lactide to glycolide ratio, so that the mesh will be tuned to biodegrade in approximately 3 to 5 months. This is optional because the collagen turnover rate is approximately 2 to 3 months. It will also provide the same anatomical support of a uterosacral ligament, which has a Young's modulus of 6.65 to 11.5 megapascals and a strength of 6.3 megapascals. This view shows the mesh where our two coatings will be placed. These are a beta-1 growth factor, which will repair connective tissues as PLGA degrades at a concentration of 600 pmols per liter, and a surface-coated RGD peptides that will enhance cellular adhesion to the muscular wall at a concentration of 100 micrograms per milliliters.
So some benefits within our biodegradable mesh include improved safety. With the previous permanent mesh, there was an 11.8% exposure rate and a 6.1% reoperation rate. And that exposure of the permanent mesh was known to lead to pain, infection, and an overall decreased quality of life. So with our biodegradable mesh, we are hoping to eliminate that 11.8% exposure, and then hopefully the reoperation rates will go down as well in correlation. With that reoperation rate going down, that will also save healthcare savings, as a 10% reduction in reoperation will save $450 million each year in the United States alone. Our design will also improve the anatomical support compared to other surgical options such as ablative surgery and native tissue repair. On the right side within the cost, you can see a table of each itemized component within our mesh, and the total cost of our mesh scaffold comes to be $320.77. Compared to the reconstructive surgeries with the permanent mesh, which cost approximately $6,000, with the mesh costing alone over $2,000 itself. And that $2,000 is about a third of the surgery cost as a total.
Looking at our device in the competitive landscape, we see decellularized dermal allografts as a competitive alternative on the left side of your screen. These allografts provide support to the pelvic compartment by providing it with extracellular matrix. However, they do not correct the pelvic organ placement, so they are only used to support the surgical procedures that are currently failing many women, as we've described. Additionally, in the center of your screen is the pessary, which is a competitive non-surgical option, but as Beth explained earlier, it causes fitting issues for many women, which eliminates it as an option for them, and its use requires monitoring, routine sterilization, lifestyle changes, and often only prolongs the need for surgery. This brings us to our solution, which will provide customizable support and anatomical correction for pelvic organ prolapse. The growth factors allow for long-term strength and recovery of the native tissue through their increased collagen production. And while the degradation will eliminate the mesh exposure and safety concerns of previous transvaginal mesh. Overall, our device will provide a prolapse treatment with the lowest recurrence rates and the best quality of life outcomes for POP patients.